20.5 million. That's how many Americans over 40 are already battling cataracts. And you probably didn't know cataracts are the leading cause of blindness worldwide, right? Now, here's something even more troubling. A recent Yale Medicine study revealed that certain medications could actually speed up cataract development. They call it drug-induced cataract. But don't worry, in this video, we'll reveal 6 medications that could be silently harming your vision. And stick around until the end, where we'll show you how to protect your eyes from drug-induced cataracts. Let's dive in. 1. Corticosteroids. Corticosteroids, like prednisone, are often prescribed to treat conditions like asthma, arthritis, and autoimmune disorders because they do an amazing job at reducing inflammation. But if you're using them long-term, there's a downside you should know about. They can cause cataracts, specifically a type called posterior subcapsular cataracts. These cataracts form at the back of the lens in your eye and can really affect your vision, making it harder to see in bright light or when you're trying to read. So, how does this happen? Corticosteroids increase oxidative stress in your eye, which damages proteins in the lens and leads to cloudiness. This oxidative stress occurs because corticosteroids alter the natural chemistry within the lens, making it more susceptible to damage from free radicals. The longer you use corticosteroids, the higher your risk becomes. Over time, this can seriously impair your ability to see, especially in challenging conditions like glaring sunlight or dim lighting. So, if corticosteroids are part of your daily routine, regular eye exams are a must to catch any early signs before they start affecting your vision. 2. Antipsychotics and SSRIs. Medications like risperidone or SSRIs, like Prozac, are essential for managing mental health conditions like schizophrenia or depression. But long-term use of these medications may cause cataracts. These drugs can cause oxidative stress in your eye's lens and affect calcium balance, both of which can accelerate cataract formation. Now, the tricky thing about cataracts is that they don't show up right away. They develop slowly, so you might not notice any changes until they've already started affecting your vision. The cataracts that form due to these medications can affect your ability to see clearly, especially when exposed to bright light or when trying to focus on something up close, like reading. And just like with corticosteroids, it's the oxidative stress that does the damage over time. These drugs interfere with the natural balance, causing cloudiness and impaired vision. The longer you take these medications, the higher your risk of developing cataracts becomes. If you've been taking these medications for years, it's important to keep an eye on your vision and make regular eye exams a priority to catch cataracts early before they get worse. 3. Insulin. Insulin is essential for people with diabetes to keep their blood sugar in check, but it might surprise you that insulin could also contribute to cataracts. It's not just fluctuating blood sugar levels that pose a risk to your eyes. Insulin itself can speed up cataract formation by increasing oxidative stress in the lens. Over time, this oxidative stress damages the lens and causes it to become cloudy. The longer you're dependent on insulin, the more oxidative stress builds up, leading to changes in the proteins within the lens. These changes gradually form cataracts, which can seriously affect your ability to see. People who use insulin, especially over many years, are at higher risk for developing these vision issues. And much like the case with corticosteroids, the risk increases with time. That's why regular eye exams are essential for anyone managing diabetes with insulin. Looking to stay active and energized? Hit subscribe and discover simple steps to better health. 4. Anti-seizure medications. Anti-seizure medications like valproic acid and carbamazepine are crucial for controlling epilepsy and other seizure disorders, but they aren't without their own risks. One of the long-term side effects you need to be aware of is cataracts. These medications can affect how the cells in your eye receive nutrients, causing the lens to become cloudy over time. The reason behind this cloudiness is that anti-seizure medications interfere with the nutrients and fluid balance within your eye, leading to oxidative stress that breaks down the proteins in the lens. The longer you're on these medications, the more likely cataracts can develop. These cataracts form slowly and affect your vision by making it harder to see clearly, especially in low light or when focusing on details. So, if you rely on anti-seizure drugs, regular eye checkups are key to spotting cataracts early. This will help you maintain your vision for as long as possible and avoid sudden surprises in your eyesight. 5. Diuretics. Diuretics, also known as water pills, are often prescribed to manage high blood pressure, heart failure, or fluid retention. While they do an excellent job in these areas, they can also lead to cataracts if used over a long period. Diuretics work by helping your body eliminate excess water and salt, but this can sometimes throw off your electrolyte balance or cause dehydration. Both of these can reduce the amount of essential nutrients reaching your eye's lens, leading to cloudiness. Over time, this nutrient deficiency starts to damage the proteins in your lens, resulting in cataract formation. The cataracts that develop due to diuretics can be particularly troublesome because they often go unnoticed until they start affecting your vision in a serious way. Symptoms like difficulty seeing in bright light, harsh reflections, or trouble reading can start to creep in, often catching people off guard. If you're on diuretics for an extended period, it's important to have regular eye exams to monitor any changes in your vision. 6. Antihistamines. Antihistamines, like Benadryl or Claritin, are common medications for managing allergies, but using them frequently or over a long time can increase your risk of cataracts. These medications can dry out your eyes and disturb the fluid balance within them, leading to oxidative stress in the lens. This stress can damage the lens over time and eventually cause cataracts to form. Cataracts caused by antihistamines may not develop immediately, but with long-term use, you may start to notice difficulty seeing clearly, especially in bright light, or when focusing on fine details. Antihistamines can also make your eyes feel dry and irritated, further increasing oxidative stress and speeding up the formation of cataracts. If you find yourself relying on antihistamines regularly, it might be worth exploring alternative treatments or, at the very least, scheduling regular eye exams with a doctor. So, what can you do to prevent or treat drug-induced cataracts? If you're concerned about cataracts because of any of these medications, don't worry, there are steps you can take to protect your vision. 1. Regular eye exams. As we've mentioned throughout this video, the most important thing you can do is get regular eye exams. Catching cataracts early means your doctor can monitor the cloudiness in your lens before it starts to interfere with your vision. If you're on any of the medications we've mentioned, make eye exams a regular part of your health routine. 2. Talk to your doctor about alternatives. If you're worried about the risk of cataracts, bring it up with your doctor. In some cases, there may be alternative medications that don't pose the same risk to your eyes. Your doctor can help you adjust your treatment plan to minimize side effects while still keeping your health condition under control. 3. Cataract surgery. If cataracts do develop, surgery is an effective treatment. The procedure involves removing the cloudy lens and replacing it with a clear artificial one. Cataract surgery is very common, highly successful, and most people recover their vision soon after the procedure. 4. Protect your eyes from UV rays. UV exposure from the sun can speed up the development of cataracts. Wearing sunglasses that block 100% of UV rays is an easy way to reduce this risk. Even if you don't spend a lot of time outdoors, investing in a good pair of UV protective sunglasses can help keep your eyes safe. 5. Eat a healthy diet. A diet rich in antioxidants can help protect your eyes from oxidative stress, one of the main culprits behind cataracts. Leafy greens like spinach and kale, along with fruits like berries and carrots, are great sources of vitamins that promote eye health. 6. Quit smoking. Smoking is a major risk factor for cataracts, as it speeds up oxidative damage throughout your body, including your eyes. If you're a smoker, quitting not only reduces your risk of cataracts, but also improves your overall health. Thank you for watching. If you're craving more wellness wisdom, make sure to leave a like and subscribe to the channel for weekly uploads.